Deep vein thrombosis, or DVT, is a serious medical condition that often remains undetected until it causes significant complications. Understanding DVT is crucial because it can affect anyone, regardless of age or lifestyle. Deep vein thrombosis, or DVT, occurs when a blood clot, known as a thrombus, forms in one or more of the deep veins, typically in the legs. These veins are responsible for carrying blood back to the heart. When a clot forms, it can partially or completely block blood flow, leading to a range of complications. If a clot dislodges from the vein, it can travel through the bloodstream to the lungs, resulting in a pulmonary embolism, or PE. Deep vein thrombosis, or DVT, is generally categorized into two main types based on the location of the blood clot: proximal DVT and distal DVT. These classifications are crucial for understanding the severity and treatment options for the condition. Proximal DVT occurs when the blood clot forms in the larger, deeper veins of the thigh or pelvis. These veins are critical pathways for blood returning to the heart, making clots in these areas particularly dangerous. Treatments may include anticoagulant medications, thrombolytic therapy, or even surgical intervention in severe cases. Distal DVT, on the other hand, involves a blood clot forming in the smaller veins, typically in the calf. These clots are generally less dangerous but still require careful monitoring and treatment. Distal DVT can sometimes extend into the proximal veins, increasing the risk of complications. Therefore, early detection and appropriate treatment are vital to prevent the progression and mitigate risks. Causes of DVT: unraveling the risk factors. Deep vein thrombosis, or DVT, is often triggered by a combination of factors that increase the blood's tendency to clot. These factors can be broadly categorized into three main categories: inherited clotting disorders, acquired risk factors, and lifestyle factors. Inherited clotting disorders are genetic predispositions that make an individual more prone to blood clot formation. These genetic factors can be passed down through generations, affecting multiple family members. Identifying a family history of DVT or clotting disorders is crucial for early detection and preventive measures. Acquired risk factors include recent surgery, which can lead to prolonged periods of immobility and increased clotting risk. Prolonged immobility, such as during long flights or bed rest, can also contribute to the development of DVT. When the body remains inactive for extended periods, blood flow slows down, increasing the likelihood of clot formation. Pregnancy, certain cancers, and hormone therapy are additional acquired risk factors. These conditions can alter the body's natural balance, making it more susceptible to clotting. Early detection is key. Common symptoms of DVT include swelling in the affected leg, usually in the calf, ankle, or foot. This swelling is often accompanied by pain, tenderness, or a cramping sensation in the affected area. The pain may worsen with standing or walking and may feel like a Charlie horse. Changes in skin color and temperature are also potential indicators of DVT. The affected area may appear red or discolored, and the skin may feel warm to the touch. A multifaceted approach. Treatment options typically include medications, compression therapy, and lifestyle modifications. Medications play a crucial role in DVT treatment. They are often the first line of defense against the progression of the disease. Anticoagulants, commonly known as blood thinners, are the mainstay of DVT therapy. These drugs are essential in preventing the formation of new clots and stopping existing ones from getting larger. They are available in various forms, including injections, oral medications, and intravenous infusions. Compression therapy, typically using graduated compression stockings, is another essential component of DVT treatment. This therapy helps to improve blood flow and reduce the risk of complications. These stockings exert graduated pressure on the legs, promoting blood flow and reducing swelling. They are particularly useful in preventing blood from pooling in the veins. Treating deep vein thrombosis, or DVT, effectively involves a multifaceted approach that aims to prevent the clot from growing larger, reduce the risk of it breaking off and traveling to the lungs, and minimize the chances of long-term complications. This comprehensive strategy is essential for ensuring the best possible outcomes for patients.